Hello and welcome to Health Matters. So glad to have you with us. I am Yomi Otaigbe. One of the common childhood disorders that can continue through adolescence and adulthood is what our discussion will be centered around today on the program. And my guest on Health Matters, a consultant psychiatrist with the Federal Neuropsychiatric Hospital, Dr. Richard Adebayo, will be telling us all about attention deficit hyperactivity disorder. Thank you so much for being with us.
It's a pleasure being here.
Thank you. Attention deficit hyperactivity disorders. I know about the hyperactivity. Tell us about everything.
It's all right. Attention deficit hyperactivity disorder, otherwise shortened as ADHD, has been in existence for so many years, so many decades. Historically, it used to be called so many names: minimal brain disorder, minimal brain dysfunction. At a stage, it was also called attention disorders. After a while, too, hyperactivity disorders. But recently, the modern nomenclature, the terminology is attention deficit hyperactivity disorder, ADHD, and it has about 3 types. There's a type that is predominantly attention problem. There's another one too that is predominantly hyperactivity disorder, and then you can have the mixed or the combined type. ADHD is a developmental disorder that affects children even earlier than 7 years of age, and as you have said, it may linger on to adolescence or even in some people into adulthood. We need to have correct some impressions that people have about ADHD. That's maybe is due to the fact that the parents are not doing their work, so their child is so disruptive, a problem to people in the school or also in the neighborhood. It's not really like that. It's a developmental disorder that is more of biological origin, that is genetically involved. Of course, there may also be some other factors that may also make the condition to become aggravated or worse. But it's also common in our environment. Globally, we can say 3 to 5% of children will have ADHD, attention deficit hyperactivity disorder. But it may even be more than that, because those are the people that we see in the hospital. There are a lot of people having such problems at home or in their schools. And oftentimes, people tend to have wrong notion about these children. And so they usually beat them up, spank them up. Parents will be making accusations and counter-accusations. It's your fault. It's due to bad parenting style or whatever, but not necessarily so.
So what happens if a child is said to have attention deficit hyperactivity disorders? What are the characteristics?
The symptoms domain, so to say, there are so many. Some are, as a result, can be classified as attention problems. Some hyperactivity or impulsivity. Okay? If you look at the attention, of course, it's so obvious that a child that's having attention problem in class may not be able to be able to listen to instructions. Okay, the child, if you give instruction, the child who is not listening is not able to maintain attention. Even if you are able to get his attention initially, later on, is easily distracted. Okay, and of course, he becomes forgetful. So some of them may start having problem in their academic pursuits, even at that tender age, even preschool. And by the time they are in school, of course, they have problems. So there are some comorbid disorders that can be associated with ADHD. But we're still looking at some of those symptoms. Anyway, such child, you give instruction, of course, as I said earlier, he will not listen. Okay, it's not following you. Okay, and he tends to shy away from anything that will make him to exert his mental capability because he's afraid that he may not be able to cope. Okay. There are some of those symptoms also that are due to hyperactivity. The child cannot sit in a place. He fidgets around. He scrams in the seats. Okay? He's busy fidgeting with his fingers and toes. And then he seems to be on the go all the time, or as if there's a motor propelling him, pushing him. So he can't just stay in a place. In a public place, or where you expect the child to remain seated, he cannot sit in a place. So in the classroom, he may even jump from his sitting arrangement. He start disrupting others. Okay? He may start jumping from desk to desk and all that. And the teachers they are shouting. They are worried. They are concerned. They termed him problematic child. And it's not that the child enjoys doing so. This is a brain abnormality that he himself cannot control. So there is also a problem of impulsivity. Before you give out complete a question, the child has blotted out. He has given answers. Of course, wrong answers. Okay, and he tends to disrupt or interferes with others. Okay, he can't follow order. Okay, he blots out answers prematurely. So people now realize that this child, oh, there's a problem with this one. And it's not, this disruption, these symptoms are not limited in one domain. At least you must find disruptions in 2 or more areas, either at home or with school or in any public place. If it happens only in school, but the child is okay at home, it's not likely that's ADHD.
You know, because I was going to say that, you know, some of these things that you say, a child not being able to sit still and, you know, just maintain himself.
Yes.
You say, okay, this is part of growing up. You see a child talking,
Yes.
you say, okay, he talks too much. And that doesn't mean the child's got attention deficit hyperactivity disorder.
Yes, that's
so what is it? What are those things that we want to look out for or clinically want to see and say, yes, this is
Yes,
ADHD.
as I said earlier, there will be disruptions in at least in 2 places, either school or in the church or in any public place, but not just limited to one. And then we will now begin to see that the ability of the child to cope, okay, either with household chores or school activities, will be impaired. So it's not just a normal childhood behavior, temper tantrums and
How
some
long
of
would
those
this
things.
have gone for us to say?
Nothing less than 6 months.
Okay. So if the child does it
must be at least
consistently.
yes, that's why I say it's a persistent developmental disorder.
Okay.
It's not just something that happens within a short time and then,
Or
we say
once
the
in a
child
while.
outgrows it. ADHD is not what a child will outgrow. It lingers on. And if you delay treatment, then it leads to a lot of complications. Because with time, the child will find it difficult to cope academically. So there may be learning disorders, learning disabilities thereafter. There will be, at a stage, the child will have anxiety disorder or depression. And if that lingers on to adolescence age, he may start experimenting with substance use, psychoactive substance use. And that's dangerous. So other things that may be there, disorder like what we call conduct disorder, may be associated with that. So these are more developmental problems that eventually you know that something is wrong with this child.
You've said it is genetic. Is there any other thing that could bring about this psychologically or something?
Well, psychologically, we have said earlier that you can't blame the parents for these disorders. But if the family is also dysfunctional, it can aggravate the situation. But honestly, primarily, it's not as a result of the faults of the parents. Of course, studies have shown that maternal problems like maybe habits like smoking during the pregnancy can also, but not
be
definitely,
a factor.
Can be a factor. Yes, can be a factor. But what scientists have discovered is that there's problem in the area what we call the prefrontal lobe of the brain.
Of the brain.
Yes, we realize that glucose utilization in the brain is slowed down, so to say, and there's a problem with some special chemicals in the brain we call the neurotransmitters, the catecholamines, the dopamines, okay, the dopamine, the norepinephrine, and the serotonin. They seem not to be in proper balance. And
Okay.
for such, studies like a PET, okay,
Okay,
have revealed that.
the picture on the screen right now, of course, I can't interpret this, but we see one brain that has ADHD and the other one.
And the normal one.
Okay.
Yes. What we are just trying to say is that there's a problem with the way the brain takes up glucose. The brain needs glucose to function. So the problem of ADHD is there's arousal problem. The brain, the nervous system is not well aroused. So that means the glucose level too, the glucose penetration to the brain is affected somehow.
So would this also account for some children that when they take perhaps soft drinks or sugary things, then they tend to be hyperactive?
Well, not
Is there any
necessarily.
connection?
No, not really. No, children, they love taking sugary things and all that. But in ADHD, it's not just a nutritional problem. No. it has to do, it goes beyond what we are seeing, you know, in terms of science, that there's problems with the special chemicals we call neurotransmitters, the catecholamines. They are affected. They are not in proper balance. And eventually we discover that this will lead to a lot of behavioral developmental problems as the child matures.
Okay, so if we find a child, for instance, that is exhibiting some or all of these symptoms that you've mentioned,
Yes.
and I bring the child to you, what are you going to be doing with such a child?
Yes, it's high time that people should realize that these are not just behavioral things alone, that you know, by spanking the child, by beating up the child will fall into line, it will be authority. It goes beyond that, because we discover lots of those children just suffer unnecessarily. So people should know that this is a brain disorder, and this is a brain disorder that can be handled. The earlier the better. So such children would need to be seen by psychiatrists, especially by child and adolescent psychiatrists. Okay? Or it doesn't mean, oh, the child is insane, is mad,
Yes,
or whatever.
because when you talk about psychiatry, people, you know, just want to stay away from it. My child is not going to go to any psychiatric hospital, and, you know, the stigma perhaps.
Yeah. In developed world, people are trying to do away with this stigma and are facing reality. So I think it's high time we also should embrace what's global and do away with our sentiments and stigmas that are not really helping a lot of people. Because with stigma and sentiments, such children will be kept in the cooler somewhere, and they will be suffering, and they will not be able to achieve their God's-given potential in life. The learning abilities will be affected. Some of them will also have maybe seizure disorders. When they get into adulthood, they have a lot of problems. They cannot keep relationships. They cannot maintain a family. They cannot keep jobs. So why holding on to sentiments and stigma? I mean holding on to our problems because of sentiments and stigmas, when we can do away with all this and help people who are in need. I think it's high time we should do away with all those mundane things.
Okay, so what kind of diagnosis would you be doing?
When we see such people, now I must also emphasize here that there's no particular laboratory test that will show that this person is having ADHD. So it's not a laboratory thing. It's a clinical assessment. And we would like to sit down with the child, also listen to the parents, listen to the teachers, okay? This is an area that is not only the doctor alone that will manage the patient. It's a multidisciplinary approach. The parents or the family, they are important people in the management of children like this. Okay? The psychiatrist or the child and adolescent psychiatrists, including clinical psychologists, they are also very helpful here. And the teachers. So we involve these people in the assessment of such a child. Sometimes there are some rating scales we use. One for the parents. There's also one that some group of rating scale that will be designed for the teachers too. Because we want to look at what happens in the school environment. Okay? We want to see what happens at home. So we want to rate properly, not just in one domain, as I said earlier. If a child has been doing well in the school, we'll follow order. Okay? But at home, it's another thing. Then it may be that there's a problem in that family setting, not necessarily that the child is having ADHD. But we like that, oh, this child is a problematic one at home. Also in the school, oh, he has come again. Okay. Then we now realize that it's not just in one domain. So we need to rate see the teachers who are handling such a child in our assessments and also in the management. They're also involved in the management, not just in the assessments. So we look at all these domains and we try to formulate a particular program, line of management that will help such a child. Medication is involved, okay? So there's some medications, stimulants that can help the brain to fire up, to measure up, and the child will also improve. And also psychological intervention that can also help. And then we also want to educate the teachers too on how the best way they can manage such children, rather than classifying them as difficult children.